Without further ado, I am going to turn the floor over to Comptroller Stringer, but actually let me just say one thing. If you would like to follow this program in live captioning, there is a button at the bottom of your screen that says closed captioning. Just click it and turn it on. We will try to get to audience questions at the end of the program if there is time. If you have a question, please feel free to put it in the Q&A box. And now please welcome Comptroller Stringer.
Well, thank you, Jessica, and I want to thank all the panelists. I want to say good evening to everybody. I want to also say thank you for joining us. I know these are different circumstances, and for those of you who loyally have gone to every one of our amazing Women History Month events, you can see this one is a little different. But I do think that when we honor the innumerable contributions women make to our city and our economy and our families and communities, how could we not have this conversation, this important conversation? And I do think the panel that we're going to have tonight and the conversation we will have is especially significant as we unpack the impacts of the COVID-19 pandemic on women in our city and their many roles as workers, as mothers, as caregivers, as business owners, and a whole lot more. And one of the things that we're thinking about is the fact that no one should have to choose between their job and their health or the health of their loved ones. But that's exactly the choice that so many women have been forced to make through this pandemic. And in partnership with A Better Balance, my office conducted a survey of 1,200 New Yorkers to ask them about their workplace flexibility, their caregiving needs during the shutdowns and all through this pandemic. And we're going to show you some new data, the data that shows how starkly we've left women, especially women of color, to shoulder the burdens of frontline jobs and part-line jobs and caregiving without resources and support. This is the second survey we've done with Better Balance, and I really want to thank them because they are such an important, integral part of the conversation in New York City on these issues, and they have always been willing to partner with government officials, including myself. This survey showed that more than half of women caring for children were forced to cut back on paid working hours compared to only 1 in 3 men. Women were also twice as likely as men to need time off from work due to child care responsibilities. And women of color were more likely than white women to have needed time off to care for a child and less likely to have paid leave available. This data is troubling, but it's not unsurprising. And this showed the systemic disparities in our workforce and economy. It really showed the crisis at hand. And so one of the reasons why we're convening this panel is I want to talk about solutions, because as we rebuild our city, we cannot reopen the economy the same way we closed it, and we cannot and we must not go back to a status quo that left so many women underserved and overexposed. And everyone in our city, regardless of gender, race, ethnicity, income, or disability, must be able to balance protecting their health care for their families and earning a steady income. And that is what we are going to discuss with our Women's History Month event tonight. Now, again, before we get into the panel, and these are pretty incredible individuals who really can speak truth to power, I do want to say that there's no doubt in my mind that we will be together again soon. We'll be able to meet each other and talk about the issues that we face as we rebuild our city. But in the meantime, I just want to say to everybody, be safe, mask up. And I do think the city is going to have a lot better days ahead. But as we get to this discussion, let me get right into it. Tonight's panelists are here with us because they are on the front lines fighting for equity in the workplace and for families. And let me introduce them to you. Dina is the co-founder and co-president of A Better Balance, Dina Bask. Dina has co-led A Better Balance's pioneering efforts to combat pregnancy and caregiver discrimination and advance fair and supportive workplace legislation, such as paid sick time and paid family and medical leave. And I've enjoyed working with her for many, many years. Camille Emegwali is Senior Vice President of Programs and Strategic Learning at the New York Women's Foundation, an amazing organization. Camille, a daughter of Jamaican immigrants and a native of Queens, oversees the foundation's strategic programming focused on advancing gender, racial, and economic justice in New York City and beyond. And Gladys Jones is the co-founder and director of ECE on the Move, a community and movement of more than 500 family, child care providers, and early childhood educators in New York City. 500 families. Gladys has seen the impact of the pandemic on her own child care business, on her fellow providers, and on the families they serve. And since the earliest days of the pandemic, they have been real life in this challenge. Now, last but not least, is somebody I know for a long time, is Lisette Nieves, is president of the Fund for the City of New York, where she develops and implements innovations in policy programs, practices, and technologies to improve the functioning of government agencies and nonprofit organizations in New York City and beyond. Lisette is also the director of educational leadership and policy studies and a full clinical professor at NYU Steinhardt. I don't know where he gets the time, she gets the time, but all these panelists are very busy. We were lucky to get them, and I'm really glad to be with them as well. So I want to thank all the panelists in advance for joining us and joining all the people on this Zoom tonight. And so why don't I just get right into it? And I'm going to start with Dina. And Dina, I want to ask you that 88% of higher income survey respondents to our survey reported having access to paid time off to manage their own illness or care for another adult, but only 33% of lower income New Yorkers did. Women had less access to leave than men, and women of color the least access. Why have these issues played out so differently for workers across the gender, race, and economic spectrum, especially in this time of COVID?
Thank you. First of all, I just want to say thank you. It was such a pleasure to work with your amazing team on this report. And I shout out to my colleagues, Sarah Brofman and Megan Rockland, who worked really hard on it as well. This report is a follow-up to a report survey that we did in 2015. And it's interesting to see the similarities and how much has changed or really exacerbated in the pandemic. Just taking a step back, because it's such an important question. For 15 years, we founded A Better Balance 15 years ago because we recognized there was a care crisis that was punishing workers across the economic spectrum, but harming low-income workers around the country the most. Especially women of color. And so while some workers had access to generous leave policies for their employer, access to workplace flexibility like telecommuting, there were such millions more who were one sick child away from losing their job because they had zero paid sick days. Those new mothers that had to go back to work within a few days because they had zero access to paid maternity leave. And part of this problem, as we wrote in our launch report in 2006, was that the labor of caregiving is undervalued in the society, right? We treat it as secondary to other forms of labor. And this is true whether you're a parent, a family caregiver, or you're a paid professional like a domestic worker. It shares a common core. And so that's why we launched this organization, and to advance stronger policies to ensure that all workers can care for themselves and their loved ones without risking their economic security, but especially low-income workers who have the fewest workplace supports. So here we are 15 years later, and the pandemic has really laid bare these structural inequalities that force too many workers to choose between caring for their own health and the health of their loved ones. And as you just shared some of these really deeply disturbing statistics, we know, unfortunately, that that these benefits continue despite New York really being a leader in many policy areas such as paid sick days and paid family leave. There are still disparities that exist. Access to flexibility, you pointed out the disparity. Retaliation is a big issue, and it was a really disturbing finding that caregivers with income below $50,000 were twice as likely as those above $100,000 to experience retaliation after making a request for flexibility. Women were more than 4 times as likely as men to experience retaliation with respect to their responsibilities as a caregiver, even higher for women of color. And interestingly, those who live with someone with a disability were twice as likely as those who do not, but to experience retaliation. And as you pointed out, access to leave is highly unequal. And so, part of the problem is, we have operated where these issues have been treating as individual problems for people to solve on their own, rather than systemic problems that will require real public policy solutions. We have made progress, and part of the progress problem with leave is that we need to do a better job with respect to outreach, education, and enforcement. There is clearly a gap, and we do need to talk. We should talk more about that. But there are also holes to plug, right, and areas to make improvements. So that is, that is an important area. So this study provides some really important data points for us as we move forward.
No question. Well, thank you, and I think you're on point. You know, Lisette, building off that, women of color are more likely to be caregivers, yet only 52% of women of color reported having a flexible work schedule, while 63% of white women did. Now, that seems to me a significant disparity, but what do you see as some of the greatest barriers to equity in the workforce, especially for women of color, pivoting up what Dina was talking about?
Yeah, so thank you for that question, Scott. I think some of the key things are that, as Dina mentioned, where women are disproportionately represented in the economy. They are in the care and service economy. They are primarily in what we consider the retail space, healthcare, childcare space, education, right? So first of all, those are areas that do not get the same wage equity that other areas do. I think that's really important. I think the other thing that's a big gatekeeper to it too is the amount of dual roles that women are playing as well too. We talk about this in terms as far as childcare, but I think what I appreciate the work that Dina does too, it's about care in general. What if we had an elder care crisis at this time too? It wasn't just a child care crisis, right? The other key thing that I think is important is disproportionality of what has happened with COVID. What do we know? We know that more people of color, the chances of death, more women of color connected to men who were dying at higher rates than others. These are important things to understand too. So just also the trauma of the connection and relationship is really important, and forced what I call unfair choices on women to make their families priorities, which meant in many cases leaving work, losing jobs, experiencing retaliation. But those were I would say the gatekeepers, the other structural issues that persisted, particularly for women of color.
It's also interesting you mentioned elder issues as well, right, which we can't forget about, which I think is significant also. Moving to Gladys. Gladys, our survey showed that all families have been struggling with the increased care demands, but those in the child care sector have been hit hardest by the pandemic. And if you'd be willing just to share what the last year's been like for you as a provider, and maybe you can also talk on the other end, what has it been like for the families you serve? Because there's been two crises at each end, right?
Okay. I think, first of all, I need to say that family child care is so not included in many things. We're just not included. And it's one of the largest modality of care that is in low income communities. And so we've been overlooked in many areas, even into the point of, as a self-employed person, as a businesswoman, as a person that's making $4 an hour because of that's the way the system is, that the state market rate is so low that we're not able to sustain ourselves even pre-pandemic. So when the pandemic came, that's it. We're no longer extinct. We're fossils in childcare deserts at this point. And so we're overlooked in many areas, and even to the point that we need sick days. We need other things that I see in the report that is for the workers. But because we're in a position that we make so little, I think that, something has to be done as far as taking care of the employer. We're not your regular employer because we just don't have the resources. And yet we are very largely needed modality. When everyone was closed, who stepped up? The only ones open was us. So we're essential workers that take care of essential workers, but yet we don't have the resources or anything to really take care of ourselves, or in order to take care of others. So what happened? People got sick, people moved away, people closed their doors, and people died. That's what, most of the world was like that, but I'm just letting you know from our perspective. So that's what's happened to us. And the city is closed. It's not open in the sense that the agencies that parents have to go and get vouchers if they do get a job, they can't get it. They can't go to anywhere. Department of Health is closed. So we're still working with a closed city. So it's difficult to rise, So what else can I say? It's childcare is not only in crisis, at this point is a tragedy. It is a tragedy.
When you say the economy is closed, there has been maybe a little too much euphoria about opening because we view opening in certain sectors. But I think if we were to do a survey or report right now to see how stark closed is for so many people who already were marginalized in the city, this would probably be something that is worth exploring even more deeply, I think. Would you agree? I think you would agree. And any of the panelists, would you jump in? And
Yeah, I would like to support Gladys on that. I mean, COVID laid bare what was already falling apart before, right? We know retail was already losing, right? We know that this is not anything new. It took a nosedive with COVID, right? This wasn't new economic trends. What it did was accelerate that and disproportionately impact women. We also know that women, particularly women of color, were some of the fastest growing small business owners, right? Who were hardest hit when we think about that, or had least access to PPP, right? So it just accelerated these kinds of structural challenges we were dealing with.
Absolutely. Camille, many of you, many of the panelists, and Camille, I would say your grantees have been sounding the alarm for years about the lack of support for working families. And why did it take a pandemic to wake up our society to these issues? And in your opinion, Camille, is society really waking up to these issues, or is this going to be a ship in the night?
Well, that's a great question, Scott. I will tell you that it's very interesting to see that child care and care in general has been centered in so many conversations today. But I will say that many of the folks that are a part of this panel will know that if you talk to us and many others, we've been shouting it from the rooftops that child care should be a number one issue. I think when we talk about society finally being awake, we're talking about what we would say is mainstream America, right? This sort of coded language for white middle-class families that have been deeply impacted by the economic devastation of this pandemic. When we think back to the early days of the pandemic, parents with children had no options. Parents who could work from home were there with their children who may not have had a consistent remote school education option, yet were expected to show up virtually to work. We know oftentimes, although we've seen shifts generationally in men taking on more of the burden of child care, it primarily lays in the lap of women, as they also are expected to show up at work. But we also know that even essential workers had to show up to work, from nurses to food delivery men, and they themselves needed childcare. So when we talk about even childcare, it was a consistent service that was being provided throughout the pandemic. And people recognize that that was essential for us to keep even just the minimal amount of our economy going. And so when I think about the work of our grantee partners, like A Better Balance, for example, they have been laser focused on this issue for a very long time, because when we talk about economic security for women, we're talking about all care issues, child care, I think it's already been mentioned, elder care. And then unfortunately, with this pandemic, we've seen folks who need support to help partners or other family and members and loved one with illnesses and needing sick leave, et cetera, to be able to take care of their family members at the same time. And so we know that women are more likely to be those caregivers taking on the bulk of that caregiving. And so I think now that that burden has been shared with many other folks who have now experienced the ability of trying to balance it all, we recognize that this is a problem, that we need universal, affordable, equitable access to care. And if we center the most marginalized and most vulnerable, women who are poor, women who have been low income, Black women, women of color, those with disabilities, older adult women who have been experiencing these issues forever, we could have been solving this issue long ago.
And I guess to all of you, Camille, I think that's a very good point. To all of you, what would you say, any trends that you've seen over the past year that sort of support these findings, or maybe a trend that, a survey goes so far and maybe there's other things that we should identify as policy makers? Anybody thinking of?
I think there are some, I think there is a greater awareness. I'm sorry, Gladys, you go ahead. You were saying
No, go ahead. You start.
I think there's a greater awareness that this isn't, and I appreciate better balance on this, this isn't the typical recession that we're used to seeing, right? That's gotten out there. I at least have to say that. That's been in the media, that's been in the news. If we treated this the way that we've treated others, we would have pushed a transportation bill first. We would have been pushing a lot of bricks and mortar stuff. That's not what's happening right away. The question is, what does a reinvestment and workforce and support for women look like? We haven't had those kinds of discussions to make it that kind of policy platform. But at least for the first time, we're seeing that shift. At least there is an acknowledgement of that. I say the other thing that's important, that's a trend, is we don't know the long-term health effects for people who survived COVID, right? And those who've been vulnerable and who've been exposed. And so this is a real issue that I think for many women of color, who primary caregivers who contracted COVID, are going to have to manage and deal with. We're still at the beginning of understand what are long-term effects to that. And that's where I say there's another level of individual vulnerability around healthcare. Now, caring for yourself, not caring for everyone else.
Right.
So
Right.
this is something I hope that we get to see more attention focused on.
Interesting. Gladys?
I don't think we have anything to be able to take care of ourselves. It's difficult for us, and it's not woe me. This is just a reality of what's happening in New York City. I'm going to talk about New York City. It's been happening pre-pandemic. We were doing bad. It was just too many injustices. We have people that are making so little money that when the pandemic came, what do we have to sustain ourselves? So, those are all inequalities. And another thing that I want to talk about is that there's not a continuum of care in the sense with education. They always think of childcare separately. Meanwhile, education has a beginning. We're the beginning. If you don't invest in the beginning, forget about the rest. That's why we have so many problems.
0-3. 0-3. Dina.
Sorry.
No, go ahead, Camille, please.
No, I was just going to add on to what Gladys said, that, we have been talking about living wage for a long time. And when we're talking about living wage, we need to talk about childcare providers, many of whom are low income Black and brown women who have been providing these services many times, often in home-based care, themselves small business owners trying to run their businesses in their home, in their living room, in their basement, and needing the support, whether as small business owners and or employers of these childcare provider companies, to be able to move forward. And I think thinking about some of the regulations that childcare businesses have had to deal with, having to reduce the number of young people that they can have in their programs, adding different pieces for healthcare, PPE, et cetera, additional costs, those things add up. And so how do we help them continue to have thriving businesses while there are new regulations, obviously for safety, but having them be able to thrive in this time?
No, that's true. That's a good point too. Dina, our survey found that 9 in 10 working New Yorkers would prefer to work remotely, or at least part of the time, right? Women were 8 times as likely as men to face workplace retaliation for requesting flexibility. What changes are needed to regulations or enforcement in New York to expand access to workplace flexibility and paid leave? Because this is clearly going to be a dominating issue.
So, breaking down that statistic, it's, people who may desire flexibility, even if they don't have access to it, right? And I think that, it's really painful, and we run a free legal helpline, and, there are so many conversations that were going on in the pandemic, right? About how hard it was. This issue really highlighted how this issue plays out so differently across the economic spectrum. Very hard for professional workers working from home with kids, and juggling and caring and helping with school and all of that. But, on our free legal helpline, we're hearing from workers who literally had no choice between leaving a child home in unsafe working conditions and earning a paycheck. And so that's, just really important to keep in mind, that working from home flexibility is an option that doesn't exist for everyone, even though many people would like it and see that it works. And that's a really good thing. So we can innovate and say, hey, flexibility, telecommuting, programs that we've been trying to pilot for forever. Now we have a lot of data points to say, and a lot of companies that are now saying, hey, this is actually workable, and, our product, it's good for our bottom line, et cetera, et cetera. But, for the low income workforce, especially for frontline workers that need to show up for work, like, how do we think about that differently, and what kind of solutions do we need? And, childcare is essential, right? It's like, just beyond, critical to this, solving this and getting women back to work, caregivers back to work. But, we also need to connect the dots with fair and supportive workplace policies. And what are the incentives, what is encouraging workers to show up for work sick? Right? Many of the workers, we did a report a few years ago, years ago, not even, it shows that some workers are, penalized for lawful absences. If they're sick, even though it's a protected right under New York City to have paid sick days, they can still get a point and lose their job. Right? Some of these policies have been suspended in the pandemic, but some of them, quietly exist or are going to go back in effect. Well, we need employers to comply with the law. Those policies need to, really so these rigid employer policies really are particularly harmful on low wage workers. And so we need to be expanding access and protecting workers who request flexibility, especially those in industries like retail and healthcare and fast food and hospitality, and those that have the most rigid workplace policies. Outreach and education, as I said earlier, just so critically important. And I think we have, a real opportunity to build, with the FFCRA expiring at the end of the year. And American Rescue is, an incredible law that will help so many workers, so many, children and families. But, emergency leave was not extended. And so there are millions of workers that, are really, really struggling without access to emergency leave in the pandemic. We should be innovating. There are tax credits that did come through. There's opportunities to expand access to emergency leave even now that we should be thinking about.
Very true. And also, to pivot to Gladys, the good news is that Congress approved $40 billion for childcare, right, as part of the American Rescue Plan. So we estimate, right, that New York's going to receive $2 billion. And now I'm partial because we have a plan called NYC Under 3 to triple the number of childcare kids in subsidized childcare. But I'll start with Gladys. But this sort of may be the moment to rethink or upend how we deal with childcare and how we close childcare deserts and how we create real opportunity for the poorest parents to go back to the workforce because they have quality childcare. And I would love to hear, starting with Gladys, what's everyone thinking about this? The money's on the way.
Well, it's on the way. Hopefully it gets to us, though, because CARES was a disaster. We didn't get it.
No, that's
okay?
true.
That's the truth of the matter. So, and also when it's coming out, if it comes our way, hopefully, that is flexible, because we're now in the times of having to we're getting perhaps thrown out of our homes. Perhaps, we don't have what to eat, even that. So it needs to be flexible for us to sustain ourselves. So when the world comes back, not to normal, but to our new paradigm, whatever, that we're able to be here. Because the truth of the matter is, a lot of people are not able to get childcare because we're not around.
But I would also say, I think you said something I think is interesting, that just because you have one bucket, if you still have rent arrears, if you still are having food insecurity, then you can't build providers can't build the network because there's 5 other steps to get back. I think that's very interesting.
Yes.
Anybody
So-
else on this?
Yeah, I think sometimes when we talk about policies, and look, I'm excited that there's more funding coming to the city, no question. We need it, desperately need it. But there's an assumption that women deal with one sphere at a time. Gladys could have 3 other children in her house, then doesn't allow her to have additional children in her house to keep running the business, right? And this is the challenge that we often think about. Like we forget that women are having multiple roles. And so I think about that too. How is that going to happen? They reach the cap just by having their children at home that would have been at school, right? So these are examples of where challenges happen also with home care providers. I say the other thing is change of perspective that the report hinted at, but I'd love to see it, and maybe Comptroller, there's something that you can take on too, which is this idea that flexibility has always been something women were supposed to be grateful for. The employee. Not that it benefited the employer. It actually benefits the employer too. Women are more loyal. We've said that, we stay at places longer, we're committed. No, and I say that because this framing of what gratitude means around flexibility has always been that women are getting much more as a result of it being flexible than the employer. And that's not the case now. We need to show that the flexibility is benefiting multiple sides here. And I'm hoping that we can get more employers that say that. I'm proud to say at the fund, we have been remote, and guess what? We have stayed on it. Look at it, it's completely changed the way we think about things, right? So yeah, so I think about flexibility different too, and I should, and we should be proud of that. So that's another narrative I hope gets changed out there.
And I think that's going to be a great conversation about what the urban American workforce is going to look like, right? Because I'm like you. We have everybody in the controls office, 788 employees, have worked for a year from home, and we haven't even unpacked that. So men, women, families, single people, it runs the gamut, right? This is a conversation we're going to have. Camille, up next, I want to ask you, what is the foundation doing to sort of center these issues and invest in organizations that are making a difference, like for working families, particularly, low income, women of color, immigrant-led households? Was there a strategy to what the foundation is prioritizing?
Absolutely. We have been focusing on the care economy for quite some time. We not only look at care as an issue of those that need it, but those that provide it. And so even in thinking about what Gladys said, thinking about the importance of sort of the smallest of the small businesses, oftentimes those home care businesses, those home-based businesses that will need that support. You hear $2 billion, but how does that actually trickle down to the small business owner, the part-time childcare provider, all of those who have been, behind in the bills trying to figure out how to keep these businesses alive? What is the support that they can get to carry on? We've also been thinking about care in a larger aspect of not only childcare, but as you mentioned at the top of the meeting, also elder care and care of other family members and loved ones with illnesses, and also those with disabilities. What I've seen growing as a major issue within the philanthropic landscape is how we can continue to invest in disability justice. And so, thinking about, again, what I mentioned earlier, which is around how do we center those that have been the most marginalized and most vulnerable. And that has unfortunately been those living with disabilities for a long time. And so now we're in an environment where we all are open to flexibility, working from home, using technology to get things done, using technology to get money to people quicker. I love the fact that people can go in their bank account and get that, their new dollars from the government super quick. And so this is how we think about these innovations. But if we continue to center those that have been most marginalized, how can we have accelerated some of these innovative ideas much quicker? And so what the foundation does is see that innovation and invest in it now, so that 5 years from now, everyone will catch up and begin to invest in those issues along with us.
Well, right, because if you invest early, it's more effective, right? Because you'll lay the foundation.
Absolutely.
Lisette, so people banty around the word workforce development, right? And it takes many shapes and forms. I have my view of, workforce development in the city post-COVID, but, for elected officials and commissioners and state leaders, give me what's the training, the policy and the partnerships that we're going to need, especially if we're going to honor this survey and address gender and racial disparities and ethnic disparities. Where does workforce development play, and where's the connection between education and training?
Absolutely. So I think there's a
be broad, but how do you break it
no,
down?
no, that's a great question. I think first of all is that particularly the one great thing about this country is people reimagine themselves all the time, right? They do. They re-credential, they rethink about themselves, they rebuild themselves, right? And so this is why we have these kind of short-term credentials, ways of retraining and thinking, right? And so this is going to be important. What are short-term certificates or even college degrees that we can help underwrite for women to get through? Right now, one of the fastest growing populations is the City of University of New York, where women of color returning who had 2 children at home. That's exactly the number that's decreasing. Think about that, right? Because all the choices that have to be made. So what does that mean? Let's take flexibility back to higher ed and say, why did we stop Saturday classes? Why can't we be doing that, right? How do we think about building on credentials that may say, so for example, if we have a home child care service, why aren't we training all of these family care providers in basic technology usage and how to do some increased 0 to 3 curriculum supports, right? These are ways that we can build an ecosystem for women who have been in the care profession to be credentialed, be recognized, and received higher wages, right? I would say too that we really do need to think about hospitality, and we need to think a bit more about healthcare and how we think about women there and how we track them. So workforce development has to be a combination between the industry and higher ed and credentialing agencies working together, but with the flexibility that lets women take advantage of those opportunities.
And I like what you're saying about telehealth. I would throw into IT as well. And tell me, as we look at micro credentialing, I don't think people understand that, if you're not ready as an adult with 2 kids or you have childcare issues, you don't even need the 2-year degree to get in the workforce, right? All you have to do, there's a number of, and I don't think we're developing that. People think, well, how am I going to go back to school? I got to take all these credits. No, you can create a program for yourself potentially that gets you into the job market differently and with better benefits.
Absolutely. And I think we need to be thinking about, we think about apprenticeships for young people. I think we need to think about apprenticeships for career changers, right? That's a way of where you're earning and learning at the same time. Why do we separate those?
Right.
Women who are managing their families can't separate those. So we should have employers that are saying, I'm going to have an apprenticeship model where they're earning and learning. We can do those together. This is what an accelerated pace requires. This is what it would mean to commit to seeing women reskilled and engaged much more quickly in the economy. So I'd love to see some of that money going to employers who are pushing the boundaries and saying that, right? Because it'd be great to say, yes, I'm going to take you for 3 months and you're going to be paid a wage and you're going to get this, you're going to do that. That we shouldn't have to do the trade-offs anymore.
That's right.
The trade-offs are not working right now.
That's right. Dina, we've now done 2 surveys. Where would you direct the conversation to the government officials, the commissioners, the state officials, the elected officials? If we were going to glean sort of the survey priority that we should be talking most about, and I know you probably have a litany, but what's the 2 that, childcare is coming out of this so front and center, and I think credentialing, job markets coming out. What would you say from the Better Balance perspective?
Right. So obviously, in addition to childcare and a strong infrastructure here in New York City and state, and again, I'm talking about New York, not nationally, right? Because we have made a lot of progress, compared to other states. We have, a sick time law here in New York City. We have in January statewide paid sick time law, a paid family leave law. But the findings were disturbing in terms of lack of awareness. And it does go to thinking that employers need to step up in terms of ensuring that workers know their rights. We run a free helpline. We do help workers every day. Our hotline, the numbers were through the roof and continue to be through the roof if we help workers understand their rights. We need more investments in, ensuring that workers understand their rights. And that can't be done necessarily agency by agency. One of my issues is that the city workforce educates on city laws, the state workforce educates on state laws, but people come with a problem and they need to understand that they have rights that and so if there could be more coordination for workers around their set of rights here in New York, as well as broader rights that may exist. I think that we've passed laws. So in addition to strengthening our leave laws, it's strengthening access to flexibility. We have some law, a law in the books in New York City that could be broadened and strengthened. We have a city and state law that protects against the city laws. It's pretty good. It's very good around protecting against discrimination against caregivers. We need to ensure workers know that that law exists and they can meaningfully take advantage of that. And to your point around dependents with disabilities, I mean, one of the workers with who have family members or loved ones with disabilities in their home. I mean, there were some really profound stats to talk about how unique challenges those caregivers face. And so we should be considering really keep centering their challenges and thinking about ways to alleviate their unique burdens in terms of perhaps some limited accommodation protections, just to make it a little bit easier for them. But I think that childcare, strengthening access to fair and flexible work, strengthening outreach, education, and enforcement of these laws that we have gotten on the books, and there's room to expand. Like I said, we can innovate here in New York around emergency leave, and we can build on our permanent paid family leave program. So that's where I would start.
Well, that's not nothing, but it's building on the great work you've done, and I don't think people understand the work everyone's done. Gladys, you've pointed out a lot of the challenges, and sometimes elected officials, including myself, think everything can happen like that and don't get down to the practicality. What is the message for the policymakers, the elected officials, as we grapple with stimulus money and the different challenges to providers to take care of the children and bring parents back into the workforce? What do we have to know?
You need to bring the folks that do the work to the table. You need to hear from them. What is the issues? And then you can work from there, because if you don't bring them, you're not going to really know what's happening from the ground. And I also wanted to ask you a question. How does universal childcare look? How would it look for us?
Look, for me, it's, we've spent a lot of time talking to so many advocates and activists about how to close childcare deserts. We did the report that showed even if you can afford childcare, you can't access it. And then we believe that both for home care, for home childcare, and also for facilities, that there's a real opportunity with the funding stream to do what was done with pre-K. The model is there. Sometimes I always don't, sometimes I have my issues with the mayor, controllers and mayors go back and forth, but, pre-K is really I think the roadmap for actually getting things done. And I think now 0 to 3 is where the brain development is, where the workforce needs to return. And I think we're still a work in progress in terms of implementation. But the advocates I've met with, including yourself around the city, I think there's a real opportunity here. And I do get excited about $2 billion in stimulus money, right? And the different buckets. But I am mindful what you said tonight, which is, we tend to think government works in silos, right? So it's not enough for childcare unless you're looking at the providers and the parents, and that's what we all have to work together on. Let me close with Camille about where we are with our organizations and the tremendous work that they do. What is going to be the challenge for not-for-profits? And I'm not just going to talk about women's issues for a second or childcare, but just the state of play with not-for-profits, because that is the root of where we're going to accomplish things, right? Everyone thinks government agencies provide services. It's actually not true. We contract with not-for-profits, and then we do everything we can to make sure that they spend more time filling out paperwork than doing their jobs. But we can change that. That's another Zoom meeting. But what's the not-for-profit challenge now post-COVID, especially as it relates to the issues we're talking about?
Well, Conchola, I'm glad you asked that question, because I think that most people often forget of the crucial and critical role that nonprofits play in our community. When we talk about the great partnership in so many corners of our city with communities that are connected because of these smaller nonprofits who, even in the midst of the pandemic, also like us, having to shut down their offices, convert to a tech approach to providing services, advocating, et cetera, they managed to still do it. Many of them didn't survive, or there are those that are still struggling on the brink of survival and are looking for an economic recovery that sees them as crucial in that work. And so I think that there are many nonprofits that are ready to join you and others who are ready to build back better. As this president is saying, how can we do things differently? How can we partner with our nonprofits who have been providing those essential services and be a part of that economic recovery that we're all looking to work for? So nonprofits are ready. They're notoriously scrappy and ready to get back to work, but also need those supports and investments in their workforce and in the services and provisions that they offer to be able to do this work. So I think they're ready, but as everyone else, they're looking for that investment in their work so they can thrive as well.
I want to say that as we conclude tonight, I want to say to the panelists, our tradition of Women's History Month has been to look at honorees who have made a difference. And I just want to say that if I was with you in person tonight, the four panelists, I think we would agree, are really honorees based on their record and what they're going to do to bring the city back. And I'm actually leaving tonight hopeful in the post-pandemic era, because I do think the brain power, the ability to think beyond the street corner and the issues that we were able to raise tonight. I just want to thank all of you for coming on and making this a very exciting Women's History Month. And I think we all learned a lot from you. I do want to promise you, if I have anything to do with it, next year, big party, music, food, a little conversation, and we'll do it a little differently. But as we think about the greatest city on earth and all the great diversity of our city, we think about how we're going to build it back better, and we're going to make it more equitable and fair. And we've got panelists who got receipts in this game. And I know many of you listening tonight are the advocates and activists over generations who made your incredible contribution. So with that said, be safe, mask up, the best is yet to come. And thank you. Let's give a big round of applause. They have to hear it for the panelists. Maybe I'm the only one clapping.
Okay, ourselves.
We'll clap for each other.
I'll never get to Zoom, folks. Thank you.
Thank you so much.
Okay.